everybody on the committee could come to Grady, see you working there, see what it's like to work in one of our nation's biggest charity hospitals, often doing work that is just incredible. Gunshot wounds, compound fractures of the femur, you name it. And I remember being there as a student and then as an intern some, and we used to always calculate how many hours and divide by our income and say, boy, we wish we could get minimum wage. But I think it is important that we get somebody with that kind of clear reasoning and critical skills, to be in charge of our government, both knowing about the medical aspect as well as, the public policy aspect. I think what I regret about this kind of hearing and I think what a lot of people in America regret about is sort of the vitriol and the rancor and the partisanship that should go into something that we kind of all want the same things. And to question your motives, I think, is insulting. To question whether you're honest is insulting. The whole question of, and I guess this would be my first question to you, did you go into public service to enrich yourself or for public service?
I have a passion for public service and a passion for people, and that's what guided our decision that some might think was a foolish decision for both of us to.
Did you take a pay cut to go into public service?
I didn't consider the remuneration for public service.
Right, but I'm guessing it would have been a pay cut. The motives as to what we should do, I think we aren't separated that much on our motives. I think we all want the most amount of insurance for people at the least amount of cost. We want, people to get access to health care. What are your motives? What are your goals? What should we do with the health care system? Do you want more people to be insured? Do you want more people to have health care? Or do you think we disagree just on how we do it and not necessarily the motives?
No, as I tried to lay out earlier, and I know time is short for everybody, but the principles that I think are absolutely imperative for a healthcare system is one that's affordable for everybody, one that provides access to health care and coverage for everybody, one is that's of the highest quality, that is responsive to patients. System isn't any good if it's not responding to patients. One that incentivizes innovation because it's the innovation that drives the high quality health care, and then one that ensures choices are made and preserved by patients. So patients ought to be the ones choosing who's treating them, where, when, and the like.
You and us by extension, Republicans by extension, have been accused of having no replacement ideas, no ideas for how to fix the system. Approximately how many bills do you have that could be regarded as replacement bills or ways to improve the health insurance system in our health care?
We've had one large term bill since March or early 2009, and then beyond that, tens of pieces of legislation to address the health care issue.
It's also been insinuated that America is this horrible, rotten place, that we don't have compassion, and I guess by extension the physicians don't. Well, as you worked as an emergency room physician or as you worked as a physician, did you always agree as part of your engagement with the hospital to treat all comers regardless of whether they had an ability to pay?
It's one of the things we pride ourselves upon, and that is that anybody that showed up in need of care was provided that care, and that was true not only in our residency but in our private orthopedic practice as well.
And it's interesting that those who say we have no compassion, extol the virtues of socialism. And you look at a country like Venezuela with great resources and an utter disaster where people can't eat, devolving into violence. And, I think it is important that we do have a debate ultimately in our country between socialism and communism and America and capitalism. One of the things that's extraordinary about our country is that just 2 years ago, in 2014, we gave away $400 billion privately, not the government, individually to your churches and to charities. We're an incredibly compassionate society, and I think often this was misplaced in sort of the wonky numbers of this number and that number within healthcare. How much we do help each other. Not only do we help each other on our country, I'll bet you half the physicians in my community in Bowling Green have gone on international trips and done international charity work. And all that is lost in saying that we're this heartless, terrible country. And I would just argue the opposite. I think the greatness of our country and the greatness of the compassion of our country, we give away more than the gross domestic product of most of these socialized countries around the world. So I think it is important. With regard to replacement, a couple of things. There are some big, broad ideas that I think would insure more people. One is the idea of legalizing the sale of all types of insurance. Under Obamacare, we made it illegal to sell certain types of inexpensive insurance. Do you think we could insure more people and help some of the people who actually don't get insurance under Obamacare to get insurance if we would legalize the sale of more types of insurance?
I think choices, as I mentioned, is absolutely vital, and I know that if we have as a principle and as a goal having patients have those choices, then I believe that patients will select the kind of coverage that they want. The choices that ought to be available to them are a full array of opportunities.
You think health savings accounts will help also some people that are not helped currently?
I think health savings accounts and high deductible catastrophic coverage are things that make a whole lot of sense for many individuals, and we ought not force anybody to do anything. It ought to be a voluntary choice, but they ought to have the choice to be able to select them.
And one of the things you've had different legislation on, and I'm a big supporter of, is allowing individuals to join together in groups to buy insurance. Do you think this has a possibility of what Senator Alexander talked about, the millions of people in the individual market? I have great sympathy for that. I was a small physician with 4 employees, and if one employee were to get sick, it could be devastating to not only to them but also to the economics of keeping them employed. But letting us join together into pools where instead of me buying insurance as one of 4 people, I could buy it in a big group, maybe 100,000 people, maybe 1 million people. And currently the laws kind of prevent that, but you had some bills for expanding that, and I'm a big fan of that. Could you mention some of the association health plans and how that might help some people to get insurance who don't have insurance currently?
Yeah. Thank you. Association health plans are one of those entities that would allow individuals who are economically aligned in some way to be able to purchase coverage together, even though they don't necessarily work together or in the same group. Individual health pools, which I think is one of the secrets to being able to solve the individual and small group market conundrum that we find ourselves in, would allow anybody to pool with anybody else solely for the purpose of purchasing health coverage. It's not a new idea. The model for it is actually the Blue Shield plan that existed decades ago that allowed people to pool their resources together for major medical coverage for hospitalization. And it just makes a lot of sense. It allows insurance to work the way it's supposed to work, which is to spread the risk, and then anybody's adverse health status doesn't drive up the cost for them or anybody else because the pool is large enough.
Thank you, Senator Paul.